Hello, my name is Dustin Anderson. I'm a student in the Doctorate of Athletic Training program at Indiana State University, and this is my virtual research proposal video. Hello, I'd like to thank everyone this morning for joining me on this conference call. As we know, the military is an active organization, and with any active organizations, injuries are going to occur. The injury that I specifically want to look at is lateral ankle sprains. Historically, the gold standard for treatment has been RICE, which is rest, ice, compression, and elevation. However, I propose that there's a better way to treat this injury in this active population. I think adding a heavy compressive wrap with early active range of motion to help reduce swelling and move edema out of the area. Early strength training, which would be done by three-way angles, which would be dorsiflexion, plantar flexion, inversion, and eversion. And early ankle mobility drills, which would be done by kneeling ankle mobility movement. And standing single leg balance would be a better means to treat lateral ankle sprains, acute lateral ankle sprains in this population. I also want to use a patient-rated outcome measure, which would be the disabilities in the physically active scale, to measure how the treatment is impacting the patient's life and attitude towards the injury. I would like to do this study at Fort Sill, Oklahoma, because there's only 4 basic training battalions at Fort Sill, Oklahoma. And before we push it out to the bigger Army basic training bases, it would be good to have a smaller, more controlled environment to do this. It'll take about a year for the study to be implemented. The staff will be educated on what's going to happen, the research parameters, and the procedures. And there would be a trial run of the research done between January to May. This will be to hash out any issues with implementation, any staffing issues, any military command issues with the program. Then from July to November, data will be collected. From the end of November to the end of December, the data will be analyzed and synthesized, and in January, a brief will be given to Military Medical Command. I think this research has the potential to impact athletic training as a profession. If we see positive outcomes, there's no reason that we couldn't test this to see if it would have the same impact in the athletic population. And it would also have a greater overreaching effect to sports medicine in general. If we find that these 3 exercises and the patient-rated outcome measure are a good way to treat lateral ankle sprains, it may have the potential to reset the gold standard for this injury. And if you have any further questions, I would love to meet with you in person or have a conference call. I welcome any questions, and I look forward to working with you.